Good morning, sir. We are Group Purple from BSN to Betty Newman, and we will be discussing about Abruptio placenta. So, what is Abruptio placenta? The placenta connects the growing baby to the mother's uterus. It acts as a lifeline that gives food and oxygen to the baby through the umbilical cord. Abruptio placenta happens when the placenta separates from the uterus before the baby is born. In most cases, the placenta stays attached to the uterus. In the case of abruptio placenta, the lifeline is placed at risk. Abruptio placenta can be life-threatening to the baby and sometimes to the mother. It can lead to premature birth, low birth weight, blood loss in the mother, and in rare cases, it can cause the death of the baby. About 1 out of 100 pregnancies has abruptio placenta. This condition is usually seen in the third trimester, but it can also happen after 20 weeks of pregnancy. The signs and symptoms of abruptio placenta includes vaginal bleeding, abdominal pain, back pain, uterine tenderness or rigidity, uterine contractions often coming one right after another. Abdominal pain and back pain often begin suddenly. The amount of vaginal bleeding can vary greatly and doesn't necessarily indicate how much of the placenta has separated from the uterus. It's possible for the blood to become trapped inside the uterus, so even with a severe placental abruption, there might be no visible bleeding. In some cases, placental abruption is slowly or chronic abruption, which can cause light, intermittent vaginal bleeding. The baby might not grow as quickly as expected, and the mother might have low amniotic fluid or other complications.
Assessments and diagnosis. Bleeding during the second trimester is usually due to placenta abruption or placenta previa. These two conditions is very important to differentiate to prevent misdiagnosis. The onset symptom is sudden and intense for placenta abruption, but quiet and insidious for placenta previa. Bleeding may be visible or concealed with placenta previa. The degree of anemia or shock is greater than the visible blood loss in placenta previa. Pain is intense and acute in placenta previa, and then assessment should be done, such as vaginal bleeding, either painful or painless, uterine pain and tenderness, fetal distress or death, disseminated intravascular coagulation, which is known as DIC, tenderness or shock disproportionate to the degree of vaginal bleeding. So after this is diagnosis. It is usually diagnosed based on the symptoms, the amount of bleeding and pain. So first, physical examination usually is done, including checking the tenderness and tone of the uterus. Second is internal examination of the vagina and cervix using speculum, blood tests such as complete blood count and rhesus typing, ultrasound to check the placenta and the location of bleeding and to check the uterus. Fetal heart monitoring may detect non-reassuring pattern of fetal death. Transabdominal or pelvic ultrasonography is also done. Transvaginal ultrasonography is necessary if placenta previa is suspected based on transabdominal ultrasound results. So also PT or PTT, which is prothrombin time or partial thromboplastin time, is done also for the blood coagulation. And then lastly, serum fibrinogen or fibrin split product, which is the most sensitive indicator. Sometimes the diagnosis of placenta abruption cannot be confirmed until childbirth, when the placenta is delivered with an attached blood clot that appears odd rather than flesh. The placenta is usually sent to the lab for further diagnostic testing.
What are the causes of abruptio placenta? Most of the time, doctors don't know the cause, but drinking alcohol or using cocaine while you're pregnant can increase your risk. Other things that can play a role include placental abruptions in previous got about a 10% chance of it happening again. And the second cause is smoking. One study showed that women who smoke before getting pregnant raise their chances of placental abruption by 40% for each they smoke. And the third cause is cocaine or other drug use. Abruption occurs in up to 10% of women who use cocaine in the last trimester or pregnancy. And fourth, high blood pressure. Whether your blood pressure was high before or after you got pregnant, work with your doctor to manage it. And the fifth is problem with your amniotic sac. This sac cushions your baby inside your uterus. It's filled with fluid. If something breaks it or make it leak before you're ready to give birth, it is the risk of possibility of placental abruption increases. And the sixth is getting pregnant later in life. Your chances of having a placental abruption are higher if you're 35 or older. In most cases, the mother is over 40. And the seventh is carrying more than one baby. Sometimes delivering the first baby can make the placenta separate before the next baby is ready to be born. And the last is abdominal trauma. This could happen if you fall and hit your belly. It could also happen in a traffic accident if your abdomen is injured. So always remember to buckle up. And you can prevent placenta abruption. But there are some things you can avoid, such as tobacco, alcohol, and drugs to reduce your odds. You should tell your doctor if you've had placenta abruption before. They'll monitor you closely, and they also may suggest other ways you can prevent it from happening again. Complication of abruptio placenta. If only a small part of the placenta separates, it may not cause many problems. But if a big part or all of it detaches from your uterus, it can cause serious harm to you and your baby. For you, this could mean major blood loss that can cause you to go into shock or need a blood transfusion, and problems with blood clotting, kidney failure or failure of other organs, and death for you or your baby. If you have a near or complete abruptio, you'll need to have C-section right away. And the complication for your baby could include, first, premature birth. This means your child is born before 37 weeks. About 10% of babies born to mothers with placenta abruptio falls into this category. And the second is problems with development. If your baby is born premature because of this condition, they may be more likely to have health problems early later in life. And third and last, stillbirth. This means your child dies in the womb after you've been pregnant for at least 20 weeks. Management for abruptio placenta. Any woman presenting with a significant antepartum hemorrhage should be resuscitated using an ABCD approach. Do not delay maternal resuscitation in order to determine fetal viability. So the ongoing management of placental abruption is dependent on the health of the fetus. So the number one is emergency delivery, indicated in the presence of maternal and or fetal compromise, and usually this is by cesarean section unless spontaneous delivery is imminent or operative vaginal birth is achievable. And even if an in utero fetal death has been diagnosed, a cesarean section may still be indicated if there is maternal compromise. And the second is induction of labor. For hemorrhage at term without maternal or fetal compromise, induction of labor is usually recommended to avoid further bleeding. And the third is conservative management. So for some partial or marginal abruptions not associated with maternal or fetal compromise, dependent on the gestation and amount of bleeding. So So in all cases, give an anti-D within 72 hours of the onset of bleeding if the woman is rhesus B negative. The treatment. It isn't possible to reattach a placenta that's separated from the wall of the uterus. Treatment options for placental abruption depend on the circumstances. So the first one is the baby isn't close to full term. If the abruption seems mild, your baby's heart rate is normal and it's too early for the baby to be born. You might be hospitalized for close monitoring. If the bleeding stops and your baby's condition is stable, you might be able to rest at home, and you might be given medication to help your baby's lungs mature and to protect the baby's brain in case early delivery becomes necessary. And the second is the baby is close to full term. So generally, after 34 weeks of pregnancy, if the placental abruption seems minimal, a closely monitored vaginal delivery might be possible. If the abruption worsens or jeopardizes your baby's health, you'll need an immediate delivery, usually a C-section. And for severe bleeding, you might need a transfusion of blood.
Nursing management for Abruptio placenta. A vital role is also upheld by the nurses during this situation. Their accurate assessment should be one of the baseline data for all healthcare providers to plot the care plan for the patient. You must first assess for signs of shock, especially when heavy bleeding occurs. Assess if the bleeding is external or internal. Monitor contraction if separation occurs during labor. Obtain baseline vital signs. Assess for the time of bleeding began, the amount and kind of bleeding, and intervention done when bleeding occurred if it started before admission. Assess for the quality of pain. We must place the woman in lateral position, not supine position, to avoid pressure in the vena cava. Monitor fetal heart sounds. Monitor maternal vital signs to establish baseline data. And avoid performing any vaginal or abdominal examination to prevent further injury to the placenta. Evaluation should be maternal vital signs are all within the normal range, especially the blood pressure. Urine output should be more than 30 ml per hour. No bleeding or minimal amount of bleeding observed. Uterus is not tense and rigid, and fetal heart sounds are within the normal range.